We're standing in the middle of our giant marquee. This has been recently put in place in the front of our emergency department, and there is a similar marquee in the front of Rockingham Emergency Department as well. So this new process, when you arrive at an emergency department, may feel overwhelming and may feel like it's delaying your care. It is extremely important for us to help sort out both COVID risk for any patient arriving, but also to contain COVID risk for all others, as in other patients arriving and also for our staff members. We will attempt to undertake this process as efficiently as possible so that you can resume your normal journey through the emergency department, but do that safely. For any patient that is self-presenting to our emergency department or not coming by ambulance, they'll initially be greeted at a screening box, which is just outside the marquee. So when you walk up to the screening box, you will either be asked some questions in person, or there may be an electronic self-registration process if there are lots of people coming. They will ask questions that help us determine the urgency of the health matter that someone's coming with, help us determine COVID risks or flags, and also screen for some vulnerabilities that make people higher risk in terms of COVID. It is critical that people answer these questions truthfully, because it really helps us to determine where we're going to look after the patient, and also assists us with keeping our staff members safe and also other patients safe. It may be if you flagged as requiring urgent healthcare interaction, then you'll be brought straight into the emergency department, and the rest of your COVID screening, etc., will all occur inside the department. If on the basis of the questions that it's felt that the patient would be safe to enter the marquee process, then they will be directed into the marquee. And they'll be greeted in the marquee by several staff members, one of whom will complete a RAT, and they will also have nursing triage completed in the marquee. For patients arriving by ambulance, for critically unwell patients, they will enter the emergency department directly, and the rest of the screening process will occur inside the department. For patients who are stable, they will be directed with their ambulance crew through to the marquee, and then they will undergo a nursing triage process and have a RAT completed in the marquee prior to entering the department. If your RAT comes back negative, then you will be directed to enter the emergency department and enter through the normal process. So you may be directed into a waiting room if the department is full at the time, or you may be directed directly into the department if there's an available space. If your test returns positive in the marquee, then you'll be escorted into a designated space within the emergency department to assist us with containing the transmission risk for everyone.